In this morning's Health Watch, cell phones and your brain. 217 million Americans now have a cell phone. That's about 71% of the population. Now a new study shows changes in the brain in cell phone users. It's fueling concerns about the effect of those phones on our health. Medical correspondent Dr. Jennifer Ashton is here to break this down for us, put it in perspective. So there's a new study that's come out that actually looked at the activity in your brain when using a cell phone. What did it find?
Correct. It was done out of the NIH, very well-constructed study, very reputable journal, looking at cell phone use and the effects on brain activity. What they did was they asked people to hold a cell phone up to the right and left sides of their head in the on and off positions, respectively, and then using a PET scan to measure brain activity known as glucose metabolism. They found that when the phone was in the on position, they actually found increase in activity shown on the PET scan in red.
So then what's the significance of that increase in activity?
Well, that's the question, and they don't know the answer, Erica. They don't know whether these are potentially harmful effects or, believe it or not, whether they could actually be positive or good effects. And the key thing here is that when you look at the effects of a cell phone, you have to understand that it does produce low-level energy known as electromagnetic radiation, non-ionizing radiation, not thought to cause any damage in terms of heating. But this study raised questions of, does it do something else? Can it lead to free radical damage? Can it lead to inflammation? And that's what they're going to be looking at in the future.
And there's long been some debate and some concern over the potential impact of a cell phone on your health.
Exactly. And multiple studies have been done, conflicting results. Most have not shown an increase in the rates of brain tumors or brain cancer. Some have. I think the key thing to remember here is that when you look at something that's been used by so many people, as you said, over the last 15 or so years, the rate of cell phone use has skyrocketed. The rate of brain tumors or brain cancer has largely remained unchanged, telling people there is probably not a direct effect.
So that's an important thing to focus on. Still, though, as we're waiting for more conclusive answers,
right,
what can we do to minimize any potential health risk?
Very common sense things, Erica. First of all, with children, because many children now have access to a cell phone, you really want to limit the use. The brains of children tend to be thinner, the skull tends to be thinner, and their brains tend to be more susceptible to any effects seen in that period. Obviously, then things like hands-free uses, while doesn't drop the energy transmission risk to zero, it will lower it. And obviously, most states have a mandate law that prevents you from driving with a cell phone held to your head. So you should be using those things anyway. And lastly, you don't want to sleep with a cell phone under your pillow or directly next to your bed. Very common sense things.
And it doesn't matter. This applies to all cell phones. It's not just smartphones or a clamshell phone, because 71% of the population, there are a lot of different phones that people use.
That's correct. And what this study showed is while it did have an increase in brain activity, about 7%, that is well below the increase in the brain activity that we see every day with things just like visual stimulation. So an area of ongoing research. We have not heard the end of it.
Okay, and then again, we could just don't always be holding it up to your head.
That's right.
Or use speakerphone too, right?
Speakerphone's good. Don't text and walk at the same time. That's another risk.
Yes, one I know too much about personally. Jen, thanks.
You bet.